Welcome back, everybody. Thank you so much for tuning in. We really do appreciate it. Please smash that like and subscribe button. It really does help us. I'm your host, plastic surgeon Dr. Bruce Hermann, and with me, as always, is the wonderful Sarah.
Hi.
Looking very good today. Love your outfit.
You.
In the box, we got Travis. How are you, bud?
I'm good. How about yourself?
Doing great, man. It's a new year.
Yeah, new
Everybody
me.
have a good New Year's. I know you guys went out and did some stuff. Was it good?
Mhm.
Yeah.
Everybody was
Great.
safe. So
Yeah,
it
everybody
a good
was
New Year.
safe. That's important. So,
Yes, indeed.
I was going to ask, do you guys have any New Year's resolutions for 2024? Anyone?
No, I don't really make resolutions. Like I have like focuses or like mantras for the year,
Okay.
but not really like
Do you have
resolutions.
anything new for the year? Anything good?
The radio thing is starting to like kind of bubble a little bit more,
Is
so
it?
that's good. Yeah.
Yeah, that's
Yeah.
awesome, man. I know you have your own show. Tell me, what's the name of your show again?
So DD in the Morning is the show that I'm a part of. It's a radio show in Dallas.
What station is that on?
It's K104, so 104.5.
And what time are you on?
I am on from 4 a.m. to 9 a.m.
Okay.
Yeah.
I'm ashamed to admit I haven't checked out your radio
It's okay.
show.
No,
I don't
it's
listen
okay.
to a ton of radio, but I'm definitely going to listen to it.
It's
and,
okay.
I encourage everyone out there to listen to Travis.
Next
I
time-
understand that it's really good. People have told me that.
Next time you're in the operating room, just go ahead, just cut it on while you operate.
I may do that,
We'll get
actually.
you through.
Okay.
Good idea.
So you guys, is it all talk or is it music talk? or
So it's music and talk.
music and talk.
It's music and talk.
K104, and it's Monday through Friday, 4 to 9.
Correct.
All right, I'm gonna check it out.
I got you. I'll
Cool.
shout you out.
Okay, man. I'll let you know. I'll shoot you a text when I'm
You're
listening.
gonna be like, he's
got
probably operating on somebody.
Yeah.
Right.
Yeah, I don't make resolutions either. I'm the only thing. This isn't a resolution, but like I really am gonna try and continue my exercise routine into the new year.
That's really good.
Yeah, it's been hard lately because it's been rainy and cold, and I'm an outside kind of runner, and so I haven't really done it the last week or so. But
Well, you know, I saw TikTok, and there was this guy talking about how the calendar, like our normal calendar, was like invented like 500 years ago, and like the natural New Year
Yes.
is supposed to be in the spring, and so when people
I think
make,
that would be awesome.
yeah, so
personally.
when people make these New Year's resolutions, we're actually like supposed to be in our
in springtime.
when you think of New Year's resolution, you think of like big and bright and like new
Yeah.
you, but really it's like it's disgusting outside.
I know.
It's like the environment doesn't
Yeah.
equal the thing. So I was like, he's like, so if you want to continue to hibernate with me until spring to start your New Year's resolution, then
I'm gonna try and keep it up. Like
Yeah.
I was doing really, really good up until I did the marathon race, and then like it's been cold and rainy. I've been slacking off, so I got to get back into it. Because if you
alright.
get out of it too far, like then it's like you're starting fresh.
Well, every month I tell myself I'm gonna eat better, but
I've been doing all right with that.
I eat okay.
Yeah, I eat
silly
pretty well.
sometimes.
Yeah. So
What is silly eating though?
Like I'll just like go eat fast food, like
Oh, fast food. I've been
sense.
so good lately about not eating fast food. I mean, that was a big thing for me when I was just not even in that recent past. Like before I started noticing my metabolism slowing down, I used to eat like hamburgers and tacos like every single day.
Taco Bueno is my weakness. I love Taco
You know,
Bueno.
I used to run the drive-through at Taco Bueno.
Really?
Yep, in high school.
Don't tell me anything gross.
It was actually good. I still eat there.
Okay, cool. I love Taco Bueno.
All right, well, we'll check back in the spring, see how our resolutions are going. But
Okay.
all right, so first segment coming up today is about buttocks enhancements, and it's something that if you've ever watched the
Those
show,
pants.
those are kind of cool, right? I like that the fabric on that. So if you've watched the show before, you know I've been kind of down on at least certain types of buttocks enhancements. And the reason I'm bringing this topic up is because people do talk about this. It is something you see all the time on social media. And I actually had a friend ask me about this just a day or so ago about like what are the options. And so I was kind of going over. I was like, oh, well, we should do a segment on that. So
For sure.
so, so I guess if you're going to talk about buttocks enhancements, the first way to kind of break these down is surgery versus non-surgery, which is a good way to break down anything when you're talking about aesthetics. And so there are a couple of surgical options out there. The first one would be buttocks implants. So just like
Yeah.
breast implants, you can get silicone implants for your butt.
Yeah.
And
And that's different from a BBL.
Correct.
Yes.
Yeah, that's because that's the next one we're going to talk about
Yeah.
is Brazilian butt lift. The short answer on buttocks implants is don't do it. These things have never been greatly popular because of the risks associated with them. You know, when you put an implant in the breast, for the most part, it goes very, very well. I mean, there's millions and millions of women out there who have breast implants, are totally happy with them. The difference in putting an implant in the buttocks area is all about the fact that you're sitting on this thing.
I know. That's like you get your butt sees a little bit more action.
You're right.
Than your chest.
That might be the quote of the day. So yeah, I mean, you're exactly right. You know, one of the things that can definitely make surgery have issues is, one, the location. So the buttocks area is not necessarily considered as clean as the chest. Okay, that's one thing. Pressure, like sitting on your buttocks. You know, when you sit on incisions, it causes issues with them wanting to heal. Also, the buttocks muscle has the ability to push the implant out of position. So these things have never been popular. There are still surgeons out there doing them. I'm highly recommend people do not get buttocks implants. I just have seen too many, you know, bad things happen from them. I've never done them, but just have seen patients have had issues. Things like infection, implant malposition, where it gets out of the place where it's supposed to be, and the butt looks terribly lumpy. Injuries to nerves. There's some big nerves that run through the buttocks, and so the placing of the implant can injure those and cause like serious issues, which is not necessarily a thing in the breast. And then finally, wounds, with it being a dirtier area, sometimes these wounds will break down, plus the pressure of sitting on them. So although buttocks implants are an option that still exists, I personally do not recommend that you do that.
So which one's better? BBL or
well, if I had to,
implant?
if somebody put a gun to my head and said you're either getting buttocks implants or you're getting a Brazilian butt lift, I guess I would take the Brazilian butt lift.
Yeah, sounds like I would too.
Yeah, so that Brazilian butt lift is the next surgical option out there for buttocks enhancements. We've talked about this on the show a lot. Basically, that is a procedure where you harvest fat from one area of your body, and then under ideal circumstances, you process that and then place it into your buttocks to augment it and shape it. And so on the surface, like it seems like it's a pretty good procedure. And I've done a ton of fat grafting more for the chest, for either cancer or occasionally for aesthetics. But oddly enough, I'm not a big fan, to say the least, of Brazilian butt lifts. I do have some issues with the surgery. For one, it does carry a 1,000 times higher rate of mortality, which is death, than the average plastic surgery. That is due to the risk of that fat getting into your bloodstream, because there are big blood vessels in the buttocks. And we've talked many times about patients that have died from BBLs. I mean, throughout the last year or so.
One of my friends recently was talking about, like, whenever she loses, you know, a specific amount of weight, that she's going to do all these things. And she's like, I'm going to get a BBL. And I was like, do not do that.
Good, Sarah. I'm glad you're like on the train with
I was like,
me.
no.
I mean, and it's not just me. There's a lot of plastic surgeons out there who are not fans of Brazilian butt lifts. The mortality risk is one thing. I will say that right off the bat, they do tend to look good. And I do have a picture I took just to show people, even though I'm not a fan of these, I wanted people to realize what they can look like. So throw up that first picture, Travis. So this is from Dr. Olson. He's from the Advanced Plastic Surgery Institute in Arizona. I mean, honestly, I think that's a great result. Like, I like the appearance, the post-op appearance.
Yeah, it matches her thighs. Sometimes people get them too big, and their thighs don't match the size of their butt.
I think the surgeon did a very skilled job. You know, I think that it looks great. My concern is that this is probably fairly recent after surgery. I mean, not like immediately, but, you know, one of the issues I have outside of the mortality rate for these is the longer term risks. You know, with fat grafting, there is always going to be some absorption. And unfortunately, the best way to limit that is to process the fat, which is a kind of a problem with Brazilian butt lifts. Because then if you process the fat properly, you end up getting a fraction of what you started with. I think I read on there that this was 1,000 cc's per side. So, you know, if the way that I process my fat, I do have like a centrifuge that I send it through to get like this pure fine fat for injection.
Where did they get the fat on this girl?
You can see it like in her hips, their flank areas.
Okay.
Yep, you can see it.
They just moved it.
Yeah, you suck it out and then ideally process and reposition. But, you know, in this case, they injected 1,000 per side. So that's 2,000 injected fat. If you were going to process the fat properly, you'd need like 6,000 cc's of fat to get that much like good fat. And so then it brings into the question, okay, was this properly processed? If it's not, then there's a much higher risk of absorption. You can also get scarring of the fat, and you can get these lumpy areas.
I feel like her butt looks cool. Like, it looks good. But I feel like she could have gotten the same results by going to the gym.
Maybe. We're going to talk about that because there is a treatment that is similar to working out. And so I want to pick your brain on that. I don't know.
Because that doesn't look abnormal.
Yeah, it just looks good.
It looks,
yeah.
she
And I
looks
do
like she just
compliment
has
that
a
doctor
cool-
on
like a
those
good
results.
butt.
I don't know that doctor. I just Googled BBL befores and afters. He's the one that popped up, so I just credited him for his pictures. And I do think it's good work.
It looks good.
So, so anyway, Brazilian butt lift, I'm not a fan. I don't think it's crazy if you go and get one, but there's definitely some potential downsides to it. And the other thing I'll say about it is, although every year plastic surgeries seem to increase in numbers, we talked about this a month or two ago, Brazilian butt lifts stay static, which means that they're not really increasing in popularity. They're not going down, but in comparison to other surgeries, they're not increasing, which does say something about them to a certain degree. So those are the two surgical options. I definitely don't like implants, and BBLs I'm really not a big fan of, as you guys are aware. So let's go on to the non-surgical options for buttock enhancements. Oddly enough, I read that some people are doing facial fillers for buttocks enhancement, which to me blows my mind because, I mean, when you're injecting in the face, there's not a whole lot of volume, and facial fillers are expensive, and the idea that you're going to put enough of hyaluronic acid filler in your butt to make a difference just is crazy.
And then it goes away.
Yeah, and then it goes away in a year and a half. Yeah. So I just kind of completely skipped over that one because I just don't think that that's realistic. But
The cost benefit's not there at all.
it's not even close. But there is one here too that I learned a little bit about. And at first when I heard about it, I was like, geez, I just don't know how this would work out. But I'm a little bit more favorable to it now. And that's the use of Sculptra. Have you guys ever heard of Sculptra? Mm-hmm. You have? Okay. So Sculptra is poly-L-lactic acid, which is basically a product it's also used in suture. I use a suture called Vicryl, which is the same substance, which in suture it just kind of breaks down slowly. But when you make it into a liquid form, which is what Sculptra is, and you inject it, it causes collagen formation.
Okay.
And this has been around forever. I remember, in fact, when I was in plastic surgery training in like 2007, my attending got Sculptra injections in his face. And I was like, wow, yeah, I can definitely see the difference. Like, it kind of plumped up his cheeks, and I thought it looked fine. Sculptra is a little bit expensive, and we're going to talk about that. But apparently people are now using it for buttocks enhancements.
Okay.
And I was like, wow. I wonder how much you would have to use. I will say that the results look pretty nice. And I did have a picture. Travis, can you throw up this next one? This is from Skinly Aesthetics in New York City. They actually had a lot of information about using Sculptra to do buttocks injections, which was great information. I think the result looks nice. It's a nice appearance. I think that this has some advantages over like a BBL. The advantages being, one, it's not surgery. Two, I don't believe it carries that higher mortality risk that BBL is associated with. You don't have as much issues with potential scarring as fat grafting does, but there are some downsides to this. I do think the results look nice. I was actually pretty surprised when I saw this. Like, dang, actually that looks pretty good. So here's the downside. So one, it's not permanent. It's a temporary effect, but it does last 3 to 4 years. So that's not too bad, right? It's better than the fillers, which last a year and a half.
Save up for the next.
Right. So here's the problem. Sculptra is not cheap. The average cost of Sculptra is about $700 per vial.
So how much was her butt, you think?
Yeah. So that's where this gets crazy. This guy there wasn't a whole lot of people who were talking about it, but that Skinly Aesthetics did have quite a bit of information. They were saying that they use at least 10 vials, on average 20 and up to 40 vials of Sculptra. So 10 would be
per butt cheek or just
total.
Okay.
Yeah.
Like,
10 would be $7,000. Like 20, which is their average, is $14,000.
That's like the price of like
More.
a boob job.
More.
Like a good one.
Yeah, more. I mean, 10 would be like the price of a breast aug. So like to me, although actually I kind of like the results and I like kind of how how it's done, where it's not surgery and it doesn't have so many risks, the cost to me seems prohibitive. Now maybe in New York City people can toss down $20,000 every few years and be okay with it. I'm not sure that would be super successful around here. Although I actually am thinking about calling the Sculptra people and asking about it. It is an off-label use. I will mention that.
So can you use it in your chest then too, if you can use it in your butt?
I would, yeah. I mean, I assume you could. Yeah. I mean, that's a great question, sir. I never thought about that you could potentially use it to augment your breast. I mean, I'm gonna look that up. I mean, that's interesting. I will say that result, and granted, with all these befores and afters, people put out like really
the best of the best.
The best of the best. And even when I was looking through them, I wanted to find one that
looks sketchy.
No. I wanted to get one that actually looked. I don't want to misrepresent these. I want to show you what is the potential best outcome. And so, those do look nice. So Sculptor is an option if you have extremely deep pockets. It's kind of a newer thing. It is off-label, but those results look reasonable. Okay, so the last one is what's called Sculpt Neo. I think we've talked about this just briefly in some other segments.
I've never heard of it.
So Sculpt is a brand of machine that uses radio frequency to treat areas. And what it does is it does two things. It reduces fat and it increases muscle. And I've actually done one of these treatments. We had the people roll through and they were trying to sell me a machine, and so they brought it up, and I did a treatment on my abs.
Yeah.
And man, it is like so what it does is it causes really, really strong muscle contraction.
Oh,
so it's like a really, really, really intense workout in like 20 minutes.
Okay.
And so you do need 4 to 6 treatments to see results with this, but they're claiming that with 4 treatments you can see up to about 25% increase in muscle mass.
Okay.
Which that's pretty impressive. I mean, and I think I did have a picture of this one as well. Travis, throw that up there. Yeah, and so I will say, to me it looks more of an athletic look, and this is where I was going to kind of pick your brain, because when people get BBLs, a lot of them want that kind of Kardashian look where the buttocks looks really round and maybe not cut. You know what I'm saying?
Yeah, whenever I think of her butt, I think I've seen other women besides celebrities have that style.
Yeah.
And the butt never matches the thighs. If in real life, if you had a butt that big,
right,
your thighs
would be muscular,
like the same. And so it just looks abnormal to me. But the one you showed before with the Sculptra, hers looked okay. Like hers looked like she just naturally had a big butt.
Right. Well, and it's just like everything. Like you could do, a Brazilian butt lift and not go crazy.
I know,
with
but
it.
I feel like the only people who get Brazilian
go crazy
butt,
with it.
Yeah, they do go crazy.
Well, I just thought that there was a differentiation between, if you went into something like Sculpt, where it's going to reduce fat, you're going to get more of that like runner look, where a runner has like, a firm buttocks, but it's not necessarily round and shapely.
Yeah.
And I'd say that before and after shows that. I mean, that her buttocks look good, but she looked like an athlete, not like Kardashian. And when I say Kardashian, I don't mean like huge.
I don't think she looked like an athlete.
You don't think so?
No, she just looks like she just looks like she was a skinny girl. Like just
Travis,
yeah.
Can you throw up that last picture one last time? The Sculpt one?
Yeah, to me she just looked like she was just a naturally thin girl that just doesn't have.
I thought she had some good muscle. Travis, you there?
I am.
Oh, sorry. I think I caught you in a bad moment. Hey, throw up that Sculpt one last time. That one you just showed.
Picture. The last butt picture.
This one.
I don't know. See, to me, she has that really kind of muscular.
If she was,
look.
to
Or at
me,
least compared to like the one on the left.
To me, if she was an athlete, her butt would not look like that.
Yeah.
Her butt would be like a good sized butt. Like her butt would look better than the one on the right.
Yeah. Well, that is only 4 treatments. I mean,
I think she's just a naturally thin girl.
I do think it looks better than the starting point.
It does.
Yeah.
It could be her panties though.
It could be. It's all
I don't know.
It's all about the accents,
if they
right?
were the same, if they were the same undies, I think it would be better.
Well,
but it does look different.
Yeah,
for sure.
But I would say that is the one differentiation with
lifted.
Sculpt, where fat grafting or Sculptor tends to get that more kind of mix of muscle and adipose tissue. Sculpt gives you more of a muscular look because it does reduce fat. So that's just something to be aware of.
Yeah, it definitely looks lifted.
And then finally, the last thing is working out.
Yes.
Working out can
Advocate.
make your buttocks look better. Yeah,
I wish I had a before and after picture of my friend who was a naturally skinny girl, like just super skinny, slender chick. And even when she was in gymnastics with me in high school, like never had like the same amount of muscle proportion that I had. And whenever she started doing Olympic weightlifting, just using weights,
right?
Not running, not doing anything like that, just strength training. her butt and her thighs got significantly bigger.
Yeah.
I wish I had before and after. I'm sure she does, but I
Right.
don't have one.
Yeah.
But her butt and her
Yeah.
thighs looked so
Of course,
much
you know,
better.
it's just hard. I mean, that
Yeah.
amount of dedication to get something
Oh,
like that.
it took her like
yeah,
a year.
It takes time. Yeah,
But-
a lot of people just can't do it. Yeah.
Yeah, but I mean,
But if you can, that's I'm
there's
always
other
a fan-
benefits besides having a good butt.
for sure. And I'm always a fan of like if you can get something on your own and avoid surgery or treatment. I mean,
Yeah,
it's
you
obviously
can't
the
really
best
get
way.
bigger boobies on your own, though.
That is hard to do.
Yeah.
It's hard to do. So, all right, I just want to recap this segment really quickly. So today we were talking about the different options for buttocks enhancements. There are a couple surgeries out there, actual buttocks implants similar to breast implants, which I'm not a big fan of due to the complication potential for that. There's Brazilian butt lift, which is injecting your own fat into your buttocks. I'm one of the people who's also against Brazilian butt lifts. It does carry a much higher mortality rate or death rate in surgery than other plastic surgery, and there are some long-term issues, but I will say they do look nice right off the bat. Some of the non-surgical options, Sculptra, which is an injectable for the buttocks, is kind of new. Some of the results look pretty nice, but the cost can be prohibitive. It sounds like you're looking at a minimum of $7,000 up to like $20,000, and it only lasts about 3 or 4 years. M-Sculpt Neo is a radiofrequency treatment which decreases fat and increases muscle to give a more muscular look to the buttocks. Not a bad treatment. Of all of them, I would maybe consider that one to be one of the better ones, but those are the options out there, and so now you know. If you have any questions, please leave us a comment. So, all right, buttocks enhancements. I think we rounded that one out. We rounded that one out.
No pun intended.
No pun intended. Okay.